Hi, my name is El Garza, and I'm the creator of phlebotomysolutions.org. As you can see, I'm sitting here in my office in my house shooting this short introductory to our YouTube video series on phlebotomy. These are PowerPoint presentation videos that I personally use in my lectures when I teach phlebotomy. I've created them to help students prepare for the national state exam as well as help phlebotomists know more about their craft. I've been an instructor for over 10 years. I've written curriculum for schools for the state for and through the state of California, and I have been in the field of phlebotomy for almost 15 years, as well as a teacher for almost 20. So these are all designed to help those who are interested in phlebotomy, taking phlebotomy, or even who's in phlebotomy. And these four volume video DVDs are available on Amazon, as well as a instructional hands-on skills DVD called Phlebotomy 101. So I'd like to know your input. Please subscribe to our channel. We have Facebook as well as our personal website, phlebotomysolutions.org. And let me know what you think. If you'd like to see more videos like these or uploaded, I can definitely do that. So again, please check these videos out. Let me know what you think. Again, they're available at our website, phlebotomysolutions.org, in a complete 4-volume set. And I hope you enjoy them. And please let me know in the comments below what you think. And don't forget to subscribe and like. Thank you.
Okay, now that we've talked about blood collection equipment, let's talk about venipuncture complications. Now, the first thing we need to be aware of while inspecting a site is that a site should be free of lesions, abrasions, scar tissue, and any damaged skin, as the picture shows below. Also, we should never select an arm that is edema. What is edema? Edema is an abnormal accumulation of fluid in the intercellular space of the body, as shown in the picture below. As you can see, her left arm is very swollen. This is the accumulation of fluid. Now, we must avoid these types of sites. Now, in the case that a patient has an IV running, the first thing is do not perform a blood draw above an IV site. The specimen will become diluted with the IV fluid. The thing we must do is use the other arm or another site altogether. Even the back of the hand is fine. This is in case both arms are hooked up to an IV, then we can use the back of the hand, called the dorsal metacarpal veins, to draw the blood. Now, in the case that there are no good veins in the back of the hands, then we must do the following. Let the nurse know to come in to shut the IV off. We then wait 2 minutes after the IV is shut off. Then we proceed to draw the blood, with the first tube being what we call a discarded tube, or a tube that we're going to throw away. Usually it's a red non-additive tube. Once we draw enough blood and fill that tube up, that tube will then get thrown in sharps. The next thing we must do once we have drawn the blood in the order of draw is let the nurse know to come back and turn the IV back on. Now, in the case that the patient has a PICC line, the nurse can possibly then draw the blood for you into a syringe where you can then transfer it into the tubes, therefore avoiding having to stick the patient. So again, if we have an IV in both arms, follow the procedure I just gave you. But in any other case, use the other arm or another site altogether. Now, another site that needs to be avoided when collecting blood is if a patient has a breast removal, referred to as a mastectomy. Now, in this case, you'd use the other arm to avoid lymphostasis. Now, in the case that you have a double mastectomy, you will then either proceed with a hand draw or a capillary skin puncture. These are the only other ways to draw blood. Now, unless you have special permission to do a foot draw, then you can proceed to draw blood from an appropriate vein from the foot. Now, another potential problem associated with tourniquet application is if the tourniquet is applied too tight. This can stop blood flow during the blood draw. Also, if a tourniquet is left on too long, the causes can be a hematoma or even hemoconcentration, where the cells get damaged and release extra fluid, which can then elevate certain blood tests. Also, if the tourniquet is applied too close to the site, a hematoma can occur. Now, This is where you have 1 minute to draw the blood after the tourniquet is applied. Now, if you are drawing multiple tubes and you are running into that 1 minute mark, then what you can do is release the tourniquet and hope that the blood still continues to flow and finish the blood draw. So again, if you're running to that 1 minute mark, release the tourniquet and continue the blood draw until your tubes are filled. Now let's talk about dealing with patient complications. One of the most common complications is called syncope or fainting. Now, what are the signs and symptoms and what to do? Now, perspiration or perspiring is one sign: pale skin, shallow or fast breathing, droopy eyelids, rapid and weak pulse, and then finally, the result is unconsciousness. This is why it's important to continue to ask the patient while you're drawing the blood, how are you doing? You doing okay? Do you feel okay? Continuous dialogue with the patient, asking them, will let you know of some signs and symptoms. Now, if a patient does pass out or become unconscious, you quickly remove the needle and tourniquet and call for help. Apply pressure to the site, lower the patient's head. If they're seated in a Fowler position, in an upright position, lower the patient's head to between their knees. Apply a cold compress to the back of the neck and face. But again, call for help, stop what you're doing, remove the needle and the tourniquet, and then proceed to attend to the patient. Now, with seizures, insulin shock, or nausea or vomiting, the routine is the same. You discontinue procedure, take the needle out, take the tourniquet out, call for help, either 911 or a coworker. Now, in the case of 911 is if you are at a patient's house or residence and you're drawing blood and something happens, seizure, they pass out or go into shock, then you want to call 911. If you're at a lab or at a hospital, then again call a coworker, have them assist you, and then follow the appropriate protocols set by your employer. Now let's talk about phlebosclerosis. Now, the word phlebosclerosis refers to the hardening of a vein. Phleb or phlebo referring to the vein, and sclerosis means hardening. Now, this is common in geriatric patients who have had frequent veni-punctures being done to them on a daily basis. So, the site will not give adequate amount of blood if you try to draw blood from a site that has phlebosclerosis. What the site may feel like is a hard or cord-like, or even lacks any kind of resilience or spongy feeling. So what do? You choose another site. Never draw from a site that you believe has phlebosclerosis, a hardening of the veins. Now let's talk about some reasons why blood may not enter into a tube. The number one cause is improper placement of a needle in the arm. Now this could happen for 4 different reasons. 1, that the bevel or the lumen is resting against the vein of the wall. 2, you've gone too deep. You've probably gone through the vein instead of going in the vein. Number 3, not deep enough. You're partially in the vein, but not completely in the vein. And number 4, the needle is resting beside the vein. If you look to the right, you'll see some pictures of the correct to improper places of needles to give you some ideas of what this is referring to. The one thing you should never do is redirect or fish in an arm. If you miss the vein completely, you should never redirect or fish around in the arm. That needle is considered to be a knife or a small scalpel that can cut away at the tissues of the skin. You might lacerate the vein, you might hit a tendon or cut a tendon, you might even hit a nerve. You could also puncture an artery. So you should never fish around or redirect a needle. The only thing you're allowed to do is either go a little bit deeper because maybe you didn't go too deep enough, or if you feel you went too far, then you pull back on the needle because maybe you went through it. These are the only options you have when you go into an arm. If you miss the vein completely, discontinue and look for another site. Another reason is the tourniquet is too tight. You tied the tourniquet too tight on the arm and now you're restricting blood flow. If this happens while the needle's in the arm, the best thing to do is release the tourniquet and hope that blood starts flowing in the tube. If it does not, then you need to discontinue and look for another site. Third, insufficient vacuum in the tube. You might have a defective tube or a tube that expired. Make sure you have extra tubes next to you or by your side so that you can go ahead and grab those and utilize them when needed. And fourth, a collapsed vein. This could happen the minute your needle goes in the vein collapses. You will see this because a hematoma will start forming immediately. You will discontinue, treat the patient, and look for another site. Now, you only have 2 sticks. If you do not get the blood within 2 sticks, then you must turn it over to another phlebotomist. You must not attempt a 3rd stick. A phlebotomist is only allowed 2 attempts to collect blood. Every phlebotomist has 2 attempts per patient. So even though you used up your 2 attempts and you didn't get blood, another phlebotomist can step in and utilize their 2 attempts. The thing you must do is inform the doctor or the RN on duty and let them know that you did not obtain the blood. These things you must be very careful because these are some of the reasons why blood may not enter a tube, and these are the reasons you need to be aware of so that you do not violate the standard of care. Now let's talk about some special situations. A hemolyzed sample. That means that the red blood cells are damaged or destroyed, as you can see the picture on the right. Now, what are some of the causes? Well, a needle with too small a diameter. That means you might be using too small of a needle, let's say a 25 gauge, and the tube you're using is too large. The vacuum is too great for the size of the needle. This can cause the blood to be hemolyzed. Also, inverting the tube too forcefully. You never want to shake a tube up and down, but invert the tube carefully after every blood draw. Now, alcohol not allowed to dry. You must allow the alcohol to dry before putting the needle in the vein. If you don't, the alcohol that's still on the arm can attach itself to the blood and hemolyze it. Now, what to do if you have a hemolyzed sample? Well, the only thing you can do is obtain a second sample. Now let's talk about why a patient could have prolonged bleeding time from a site after a blood draw. Some of the causes could be medication. The patient could be taking heparin or aspirin or Coumadin or warfarin. These are all blood thinners. These will cause the patient to continue to bleed after a blood draw and should be considered when drawing the blood. Also, improper application of pressure. You must put enough pressure on the site and allow 3 to 5 minutes to stop the blood. Hemostasis is what you're looking for. If the patient is continuously bleeding after 3 to 5 minutes, apply another 3 to 5 minute pressure on there and wait for hemostasis. If the patient does not stop bleeding after the 3 to 5 minute time frames, then we need to get medical attention for this patient. Now, it doesn't hurt to ask the patient if they are on any kind of medication before you draw the blood. If the patient says, yes, I'm taking aspirin every day, or yes, I'm on a blood thinner, then you know that you need to be careful and apply enough pressure, probably longer than the standard 3 to 5 minutes. Now, what to do? Well, if a patient is still bleeding, keep firm, steady pressure until the bleeding stops. Look for hemostasis. That means the stoppage of bleeding. And of course, you can apply some ice if needed. But if the patient continues to bleed after the second 3 to 5, we must seek medical attention. All right, let's talk about a punctured artery. There are a few reasons why you would have punctured an artery. The first one is you're going for the basilic vein and you miss and go right into the brachial artery. You'll know this because once you put the evacuated tube in the holder, you'll notice bright cherry red blood shoot into the tube. If you see that, that probably means you have went into the brachial artery. Now, if you're using a butterfly, you will see within the tubing of the butterfly going right into the tube, you'll see a pulsing of the blood. And if the blood, again, is bright cherry red, then you are probably in the brachial artery. You'll see the pulsing and the bright color. Now, this could happen while you're attempting the basilic vein. This is why the basilic vein should not be considered and should be the last resort when you have looked on both arms and on the back of the hands for veins. Now, the other thing is you could rupture or puncture the artery because you are fishing or probing in the site of the basilic vein. You should never fish or redirect needles in the arm because you can nick or puncture the artery and cause internal bleeding. This is very dangerous for the patient. So what to do? Immediately, if you suspect that you have missed the brachial, you have ruptured the brachial artery, or you're in the brachial artery rather than the basilic vein, stop the procedure, remove the needle, and apply firm pressure on the site. Once you have it controlled, then you can look on the other arm or for another site to draw and obtain the blood. Now, what happens when a blood sample is not obtained? So you have the needle in the vein and you're not getting blood into the tube. Well, you could do a few things. Change the tubes. We talked about earlier you could have expired tubes or bad tubes. So get another tube, pop it in, and see if blood flows. Or reposition the needle. Now, as we mentioned, you may not fish or probe around. Reposition the needle means you can go a little bit deeper because maybe you didn't go deep enough, or maybe you went too deep and you need to pull back a little bit. As you do so, you'll see blood flow in the tube when you're in the vein. Or you can adjust the tourniquet. Your tourniquet might be too tight. You might have to untie the tourniquet and see if blood flows in the tube. This is important. These are the only three things you can do to determine if you are in the vein or why you're not getting a blood sample. Now, inadequate sample will be rejected. If you do not fill up the tubes to its proper filling line, the sample could be and can be rejected by the lab. You don't want to take a chance. Get enough blood in every tube. Wait till the evacuate tube stops. This tells you that you have enough blood. It will be rejected if you short the tube of the blood. The blood to additive ratio must be met with every tube. Now let's talk about a hematoma and some treatment. Now, a hematoma is blood leaking into the tissues. When you insert the needle and let's say the vein collapses, you will see blood leak into the tissues and a mounting might start to develop. What are some of the causes? Well, a fragile vein. The vein might have been too fragile for the needle might have been too big for the vein and therefore ruptured the vein. Also, the needle penetrates all the way through the vein. You could push through the vein and the vein can collapse. Well, you could also have a partly inserted needle. You didn't put the needle all the way in the vein, and once you pop that tube in, the vacuum causes the collapse of the vein. Again, this goes back to being fragile veins, or even veins that are too small for the needle. Also, the needle removed while the tourniquet is still on. If you fail to remove the tourniquet first before the needle, a hematoma can occur. And last, inadequate applied pressure after procedure. If you do not apply the proper pressure within 3 to 5 minutes, a hematoma can develop. And the treatment, of course, is utilizing a cold and hot pack at different times. If there is real damage to the site, the patient might have to seek a physician for help. All right, let's talk about some long-term complications and ways to avoid them. Some things that a patient could go through is fearfulness, a bad experience, or a hematoma that was caused by the phlebotomist. These are some things that can both physically and psychologically damage a patient. They might have been scarred from other phlebotomy treatments and therefore are more fearful to come in to get their blood drawn. A very bad experience with the phlebotomist. The phlebotomist probed and dug around their arm and caused a bad hematoma and bruising and maybe even long-term damage. Ways to avoid this is always explain the procedure to the patient. Be courteous, be kind. Explain to them if you see that they're fearful. Give them comfort and reassurance. Be confident. Let the patient know that you know what you're doing. And of course, follow the guidelines and procedures that are set by your hospital and by the state. Do not violate the standard of care. All right, let's take a quick review. Veins that feel hard and cord-like when palpated may be collapsed, fistulas, or sclerosis. Take a few seconds and think. If you said or thinking sclerosis, you are correct. Remember the word phlebosclerosis, the hardening of the veins? These are when the veins feel hard or cord-like because the veins have been used so many times by blood draws. This happens to a lot of geriatric patients. Next question, when the arm of the patient is swollen with excess fluids, the condition is called edema, hemoconcentration, or hemolysis. Take a few seconds. If you said or are thinking edema, you are correct. Edema is when you have excess fluid in the patient's arm or any part of the body and it swells up. This is called edema. If you've got these right, then you have been paying attention to the video. If you've missed one or both of these, please go back and review the video so you understand these terms and what they mean. They could come up on the national test. This is the end of this video presentation, venipuncture complications.